All right. Hello, everyone. My name is Tim Galvin. Thank you for taking your time to join us today and to learn more about Visual DX. I hope everyone can hear me okay. Feel free to text any questions or comments you have into the chat area of the call, and we will get those addressed for you. Again, my name is Tim Galvin. I'm the Director of Business Development. My background is in nursing and telemetry, med-surg, ICU, spinal cord and brain injury, so I've had a lot of experience there. My plan is to take a few minutes today and walk through Visual DX to show you both the user interface on the desktop and within our mobile device. Also, I have Dr. Azeen Sadigian on the line. Azeen, you want to introduce yourself?
Hi, everybody. My name is Azeen Sadigian. I'm a board-certified dermatologist in Baton Rouge, Louisiana. Thank you for having me.
Great. Thank you, Azeen. Well, I hope everyone can see the screen. I'm pretty sure everyone can. We tested this before we got going, but what you will see here is the user interface for Visual DX. Visual DX is a point-of-care clinical decision support tool. It's used widely across critical care, primary care, as well as through graduate education and through med school and graduate nursing programs. So it does have a lot of uses, but today I'm going to show you the power of what it is from a content perspective and how it is typically used. So again, ask any questions in the chat. So typically Visual DX is going to be used by providers in primary care, or associated specialties such as dermatology, and it'll be used to either figure out, hey, what is going on, what just walked in my door, or I know what just walked in my door and I just want to engage the patient, share the screen with them, show them pictures. So kind of working forward or backwards. So I'll start with you knowing what the patient would have. So let's say it's herpes zosters and shingles. And depending on the age of the patient and the diagnosis, Visual DX, if it corresponds with the diagnosis, covers everything from a neonate all the way through adult. So this is what the page will look like. What you can do on the desktop, you can also do on the mobile device. We provide a quick point of care, quick read synopsis of what herpes zoster is. We provide the codes, ICD-10 SNOMED codes, what to look for. You can scroll down or you can quick jump as I'm showing you over here on the left side. What are the differential diagnosis or pitfalls associated with shingles? What are the best tests to run? Any management pearls that are associated with it, therapy guidelines, drug reaction data. So this will be a list of drugs with literature or evidence of indicating an adverse association with shingles. And these, you can see the citations here. You can quick jump to any of these for the PubMed reference itself. So you can dig right into it, right at the point of care. And then, of course, we have the references themselves at the bottom of the page. We have our own in-house librarian team here at Visual DX. They are constantly scouring PubMed and the latest and greatest journals out there to keep it updated and reviewed very, very recently, and almost quarterly is what we do. So you can always see when it was last reviewed or updated when you scroll to the bottom of the page. Of course, Visual DX being visual, it's about the pictures. And you can see, you can view all of these images, and you can hover over the images to get a nice summary of what you're looking at. But what's really powerful is that you can filter these images. You can filter them by body location. You can filter them, which is really powerful, by skin type. Visual DX has been covering skin types 1 through 6 for 20 years now. So we've heavily focused on providing content around skin types 4 through 6 as well. So if you have a patient that has darker skin, you can actually pull up the pictures that are associated. and literally share the screen, turn the screen to them, share with them what's going on, and really build that trust and engagement with the patient as well. So I will jump back out here to the synopsis of this, and like to note that we also have over 300 patient handouts written in English and in Spanish at a elementary school level. You can either email directly to the patient from our servers, not from your personal email, the self-care patient handouts, or you can print them out right on site and hand them to the patient. So that would look like, just to give you an example, you could also say choose the associated picture that corresponds where they might be suffering from the disease, and print it out and make sure that they're taking care of themselves at home so they don't get readmitted. So that is working with, if you do know what's going on with your patient, and just providing information to the patient, and kind of driving down that anxiety and educating the patient as well. So I will stop there. Azine, do you have anything to add on that?
Yes, this is one of my favorite aspects of Visual DX is this information on the synopsis page. And so what this does is it really draws your attention to what's important, because when you're accessing this, it's often in real time at the bedside, and you need something rapid, and you need to be able to visually cue to what the information you need. You're not going to read every single line. So sometimes it's just, I really do need to know the code, or I want to know the best test. I like the diagnostic pearls because it's almost like having a former attending with you, kind of coaching you in your ear. And I think, sometimes I just really want to know what's medication I need to prescribe and what test do I need to order, in terms of like, what is the best therapy right now, because things change every year. Another aspect that I like about it is it does save time for me clinically by I can use the handouts, and that actually speeds up my workflow. You can have an MA print it from your iPad or from your computer, and it's HIPAA compliant, so you don't have to worry about that. If you're doing telemedicine, you could also email it. Like Tim was saying, it's not stored. Your information and the patient's information is not stored. And then lastly, for the patient pictures, what I appreciate is, sometimes the diagnosis, but the patient might have an atypical presentation, and they're like, well, I saw pictures of it and it didn't look anything like that. You're able to establish trust by showing them like, this image looks like what you have. And a lot of times, especially with telemedicine cases, patients come in and they've already kind of done some research on the internet before even seeing you. If you're seeing them via telemed, they're not really confident that you're able to understand all their symptoms and diagnoses, because there's not that in-person interaction. And so being able to share your screen and talk with them and then make it more interactive is really helpful in establishing that trust, that patient trust.
Great. Thank you, Azine. Really appreciate it. Great points. So that's if you're working with knowing again what your patient has, and you want to share that content with them. And let's say as I mentioned to begin the call with, that you have no idea what just walked in your door. The other powerful piece of Visual DX is our differential builder. You can literally start with the chief complaint and work from there. But you will also notice on our start page here, we have these quick start areas that cover a lot of different of the modalities across medicine that also help, start with the differential, figure out as a second opinion over your shoulder, what's going on with my patient. So you can either jump into these, we cover anything from the, eye, what are you looking at in the eye? Again, making it very visual. We can even go into, what are you looking at in the mouth? So we show you again visually how to build something out from there. I just wanted to show you with these quick start guides. What has also been a new addition to us, but what we've been doing for over 20 years now, you actually have a search capability of building a differential with regarding skin of color specific. This is due to addressing, which is a hot topic this day and age of bias in medicine. We are have had this, which helps build trust in patient engagement in areas or populations of color. So again, what kind of skin lesion are you looking at? What is the location of the skin lesion? So let's start a workup for here, and I'll show you exactly what this looks like. So say you've had someone present with a skin lesion. Say it's a blanching macule. You select that. You can select the age over here. Say we're dealing with the 50 to 59-year-old male. Skin of color, blanching macule. You can actually see where the location is. Say it's scattered many. Actually, the location is more specific. It's on the leg, lower leg. You can, the more findings you put in, obviously, the narrower the results are going to be. What are the symptoms and signs? Say, it doesn't itch. They do have a fever. The parents of the patient looks well. What was the onset of the findings? It developed days to weeks. Any exposures? What was the medical history? Any travel history? You see where I'm going with this. So the more you put in, the better, but I'm just going to leave it at what these findings are I've put in here so far. We're going to jump out into the differential. And you'll see how we will break this down based on the symptoms you've entered, the findings you've entered, starting with that chief complaint of a rash. We break it down into these folders at the top of the screen. You'll see consider first will be the more common presentations based on the symptoms you entered. Considered second are going to be the more rare presentations based on the symptoms you entered. Emergencies are going to be emergencies. Any infectious diseases related to the symptoms you entered, and anything that's drug-induced related to the symptoms. But jumping back out to consider first, as you scroll over the pictures themselves, you can see how many of your findings matched up to the findings you entered. You can see on viral exanthem, 6 out of 6. Cellulitis is 5 out of 6. You see where I'm going with this. So you can actually hover over, you can click on them once to get a quick read summary of the content to identify, is this what's going on with my patient? And if you don't think that is, you can go on to the next one. So, based on what you enter, maybe you don't think it's viral exanthem and you feel strongly it's cellulitis, which is a commonly misdiagnosed presentation, especially in primary care. So let's jump out to the full article on this. Again, because I entered, we're dealing with 50 to 59-year-old male. It jumps into adult. And again, it will jump right out to that content I showed you before. It has patient handout, codes, what to look for. And again, all meant to deal at the point of, be able to deal with a quick content at the point of care. Jump out to all images. Again, we started this build with skin of color, so that's going to present first. That's what you'll have with our differential capabilities, with starting with the chief complaint. So I will pause there. Zine, do you want to add anything to this?
Yes, I think this is a really important subject to talk about. So obviously, we're aware of the potential biases as diseases present in different ethnicities and races and skin of color. So that is why this feature was created. But I think even older than that issue is the fact that physicians, we face cognitive biases, even if it's unrelated to skin of color differences. Meaning, what does that mean? It means that sometimes we have premature closure. We assume that we know a differential, but we haven't made our differential broad enough. And we may only diagnose somebody based off of our knowledge of what we know. And as you know, we don't know every single thing. There's new diseases coming out, and there's diseases we may not have even learned about in our training. So when you build a differential like that, I find that it's actually very helpful for your patient in providing them a security and making sure that you're limiting your cognitive bias and errors. And it's a safety net because the buck stops with you as the clinician. How I use it is actually, if I have a really tough case, a lot of times, if I'm not able to get my differential broad enough, I'll use this to broaden my differential. Or if I have a case that I assume does, let's say if it was, I thought it was rosacea or something like that, and the patient's not getting better on treatment, I need to take a step back and reevaluate and start from square one and make sure I'm not missing anything. When you were at the differential builder page, you can see there are different tabs. And one of the tabs was for emergency situations, which I think is always worth looking at because you don't want something bad to happen on your watch. Number 2 is drug reaction data. Drug reaction data is really important because right now we're living in the age of polypharmacy, meaning patients are coming in with they're sometimes on 10 medications. I've seen as high as 20, and that could be causing their issues. And so it's really important to look at all of that. And you don't have to read every single thing in the differential, because you're able to skim through it and say, like, I know it's not this, I know it's not that. So that has been helpful in limiting my bias, and then minimizing my diagnostic pitfalls. And another thing is, we showed you how you could build the differential. It's if you are working on the fly and you don't have a lot of time, you can actually type in things. So you have a patient who has, like, let's say, a fever. They have hematuria, they have leukocytosis. You could type all of that in. You don't have to, like, manually click and search for everything. And you could build a differential in seconds.
Thank you, Azine. Great points again, as always. I had a question here from Michael Bennett. If I'll show the oral medicine category, I'd be more than happy to. Let me jump into that. This will be our ENT oral workup for oral lesions. And regarding the workups, each of these workups are done in correlation with the specialist in this area. So the workup is done according to how it would be done if someone would be seeing someone live in person. So from an oral lesion perspective, you can say, what are we looking at from an oral lesion perspective? Oral white plaque, you can select that. Let's go back here. Perhaps it's this, where's the location of it? You can see this, say, say it's in the hard palate. What are the oral symptoms and signs? You can show, say, mouth pain, glossodynia. I hope I'm not butchering that word, but the good thing about also Visual DX, at the same time, say someone that's not a specialist in this area gets to learn, it kind of educates them moving through this buildup. So, tongue pain, it puts it in the layman terms if you kind of hover over the information button on the side. So, say they have dry mouth, what's their medical history? They might be on a medication. You can put that, put that in up here as well. So, say they're on warfarin. So, you can see where I'm going. So jump out to the differential. Again, we break it down the same way. Consider first, consider second, emergencies, and we'll provide the pictures that correspond with it. So, and the same content. What's the synopsis code? Look for what are the therapy guidelines, any medicine, drug reaction data, and the references. But more powerfully, most powerful as being visual, is the images themselves. So, and I'd like to point out regarding the images, this is not a wiki model. This is these are all private collections that are shared with us from universities or specialists that have been in the field for a long time. So while I take a pause, Azine, you want to add anything more while I boot up the mobile piece?
Sure. So speaking to the atlas of Visual DX, one thing I want to caution is against Googling images. And I like to use the example of if you just try to Google your own name, you will see pictures of a lot of other people. And so the thing about Visual DX is these images are sent in and curated and they're evaluated. Nothing is just like accepted as like, from an internet source not verified. So these are the international medical community is submitting these images and they are being vetted out.
Great. Thank you so much, Azine. Great points. Can everyone see my phone?
Yes.
Okay. Wonderful. So as I mentioned before, anything you can do on the desktop, you can do on the phone, except for one additional feature. This is going to be our augmented intelligence, our AI enabled Derm expert. You can see it has the quick start guide as you saw on the UI for the desktop, very similar to what you can do on the mobile. You can literally start putting in a symptom or a drug or a disease at the top here to build your differential as you could online. But again, more importantly, Derm Expert is very powerful, a very powerful tool in helping identify skin lesions or anything that presents on the skin. You would click on this picture. You can see my camera in the top corner there. You would click on the camera You can see my keyboard. Under good light, under focused on your camera, you would take a picture of the skin lesion that the patient would present with. So I actually have some preloaded pictures. This patient here presented to one of our clients' urgent care clinics. The PA that was treating this patient, all of that she was told is that this lady had tied a string around this 2 weeks prior and ripped it off, and it grew back to be 4 times bigger than it was. The PA called the attending. The attending had no idea what it was, but they did have a derm expert, have capabilities to access derm expert. They took a picture of it under good light. They utilized the photo, analyzed the photos. So everything is done right on the phone itself. I want to highlight there's no PHI. It's 100% HIPAA compliant. Everything's done on the machine learning within the phone itself. So there's no security control concerns here. After analyzing the photo, the AI suggests some options. The green bar underneath friable papule indicates it feels strongly. That's what it is. However, it does provide some other options, and you can see select a different lesion at the bottom. This is providing a second opinion. If you don't feel like what it's telling you is right, you have the option to edit it. So again, it's just making a suggestion here. So they went with friable papule. Click next. They were dealing with a 50 to 59-year-old female. Next, it was a single growth lesion. It was on the hands, more specifically on the fingers. It did not itch. It developed acutely, and the patient appears well. Again, it will work, and we'll break it down as you've seen on the desktop at the top there. We'll break it down into different folders, what to consider first, consider second, anything infectious disease, etc. You also have the option of doing the skin of color search at the top there as well. However, they were doing this search right in front of the patient. You can see that the green bar indicates that's how strongly it feels that the AI feels what you're dealing with. So they tapped on lobular capillary hemangioma. I might be butchering that, Azine. You can correct me if I'm wrong. But
lobular capillary hemangioma.
So they were in front of the patient literally. So again, this quick synopsis, all the content's there, but they would just jumped right into the pictures themselves. So they started scrolling through the pictures, and everyone they went there, they're like, yep. And they got to this one, same location, just a little bit smaller. Showed it to the patient. They determined that's what it was. They went right to how to treat it. They froze it off. They were able to treat it right there in the urgent care. They went right to the patient handout, printed it out for her for self-care at home, and sent her on her way. So that's the power of Derm Expert. Azine, you want to add anything to that?
Yes, I think this is a really great tool, especially if you don't have a dermatologist right next to you. This is obviously less useful for dermatologists as it is for other specialties, but and I don't think this is replacing a dermatologist by any means. What this allows other specialties to do is to appropriately triage patients, meaning somebody comes into the ER, if somebody comes into your clinic and they have this weird, strange looking spot. Sometimes if you saw a spot like that, and the next dermatology appointment's not for a month, you might panic. Like, what do I do next? So this is kind of allowing you, like, do I really need to try to, page the doctor and see if we can get an appointment today, or can this wait a couple of weeks, or can this wait till the next available? And so, and what do I do when I send the patient out? So this is really helpful in helping triage and better manage care until you can see a specialist.
Thank you, Azine. I'm just kind of going through, building another one, just to show you what this looks like. Yep, it's correct on the cutaneous horn. So, all right. Well, let's see here. Do we have any? I see we might have some other questions in here. Do we have radiographic images for the head and the neck? I believe we do. And I'll do this on the phone. Let's say neck injury. Patients.
While Tim's looking that up, we do have numerous radiographic images throughout Visual DX. And for example, for COVID, you're not just seeing skin findings, you're seeing, chest CTs, x-rays, things of that nature. So, and the beauty of Visual DX is because we are a landing place for the medical community internationally. We were getting images rapidly from all across the world during COVID. And even if you find that there's something that you don't see in Visual DX, please let us know. They will add it, instantly, and they'll try to source, appropriate information, and including radiographs or even EKGs and things of that nature.
Thank you, Azine. Let's see here. Sorry for the background noise. As a lot of us are these days, you have your kids at home with you, so juggling duties. Wonderful. I don't see that there's any more questions in there. Do we have clinical? Let's see here. Spinal disorders, head and shoulder tilt, forward head posture. I don't know if we get that specific, but I can tell you right now, Michael, that we are in the throes of updating all of our osteo content within Visual DX. So we're updating all that up, and I believe by the end of Q1 of 21, we're going to have all of that imagery updated with images of what you're requesting. On top of that, with a lot of MCL, ACL, orthopedic content as well, updated with that. So that is coming. We're all ever evolving with quarterly updates. We're a smaller company, so we have the agility to constantly update our content and to add new content. If you have any other questions, feel free to enter them into the chat now. I'd like to also point out that if anyone would like to test drive Visual DX, you can go to visualdx.com. You can sign up for a 30-day free trial and test drive the capabilities of Visual DX. We also do, if this is a tool that anyone's interested in, to provide for more than one provider. We also do enterprise quotes if it's larger than a single subscription. So please reach out to us and let us know. We can let you know how you can access it.
Thank you, Tim. I just want to add, I actually used Visual DX as a resident before starting clinical practice, and I found it very helpful in both seasons of my career, educationally and clinically. Educationally, I think one of the best ways you can use this is whenever you're doing your mock, or whenever you are, doing your board review studying, or however you are studying, or lifelong students in medicine. You can actually have Visual DX pulled up on your phone or on your computer while you're studying your educational materials, and or even looking at journals. And so I found that very helpful as well. And then also the fact that the medical librarians have linked out critical articles for each diagnosis is really helpful if you're preparing for a case report or a case presentation in front of your group.
Yeah, that's a good point, Azine. Another thing I'd like to focus on that, in terms of today's day and age of virtual care, maybe some e-visits that providers deal with. We also have dynamic link capabilities. So if it's, say, again, not replacing a dermatologist here, but say an emergency department doctor reached out via e-visit to a dermatologist about a patient that presented in the ED, and the dermatologist receives a picture from that emergency department physician, upon looking at it, a dermatologist knows exactly what it is. I mean, just for case example, let's just say it's psoriasis. So we'll click on psoriasis. And you can actually see up here, you can share this page as a dynamic link. You can copy this right to your clipboard, copy that, and then paste that into an email response back to that emergency department physician. If the system or the organization has access enterprise-wide or across the system, that doctor and the emergency department would then open this link right to psoriasis and have everything right at their fingertips as far as the synopsis, share the screen with the patient, and also be able to treat the patient right there as well. So wanted to point that out. And another piece with Visual DX, every time you do a search within Visual DX and you're a registered user, you acquire CME. So I'll show you an example of this. So every search you do, you would click on your previous searches. You would answer some questions on how it helped with your diagnosis or how it helped treat the patient. And then you will receive a half credit, and that would be a point AMA PRA Category 1 credit for every search you do in here. So if you use UpToDate, it's very similar to how they do it. And another point is about UpToDate is we're the only internal partner of UpToDate. We actually integrate with us. They utilize us for their pictures. So if you have a subscription to UpToDate and you acquire a subscription to Visual DX, you'll be able to, within your workflow, jump in and out of UpToDate into Visual DX and vice versa. And as you can see here, that link would live over here on the left side. And you would be able to jump right out into UpToDate if you want that additional content, what you were searching for within Visual DX. All right, well, if no one has any additional questions, feel free to visit our website, sign up for the free trial, or reach out to us if you'd like some additional information on how we assist in education, primary care, and graduate education. Thank you, everyone. Have a great day.